I'm Dr. Sazgar. I am an epileptologist, epilepsy specialist with the University of California, Irvine Medical Center in Orange County, California. And I am a part of the comprehensive epilepsy program, level 4 program in the university.
So do you talk with two patients who are children and also adults as well?
I do have both pediatric and adult epilepsy expertise, but at the UCI I am treating only patients 14 years and above, so it is mostly adult population. My specific interest is women with epilepsy and their specific issues.
Okay, so why is that? Why does that interest you?
Because women with epilepsy, they have a whole lot of unique issues related to their gender. So it's very important for an epilepsy doctor to recognize all those issues and be able to handle them. Half of the population are women, so about 1.5 million American people are women with epilepsy. 1% of population, as you know, have epilepsy. 24,000 of women with epilepsy give birth each year. So there's a ton of issues regarding how the hormones affect the brain and why these people have the kind of epilepsy that changes with the hormonal level change in their body. There are issues regarding birth control. Would it fail with certain medications? There are issues regarding pregnancy, whether either the seizures or the seizure medications can affect my baby. So there's a whole lot of things that are absolutely important to address in women with epilepsy, and that's my passion. That's what I deal with. In addition to medically refractory epilepsy and dealing with epilepsy surgery, but women with epilepsy is what I do.
Oh, okay. What was your talk about here at Epilepsy Awareness Day 2016?
So my talk was about the women with epilepsy specific issues, so that I just gave a talk and it was well received. A lot, and I basically talked.
Did you get many questions?
I did. Some of the people followed me to the table of the UCI in order to ask the questions. So I'm glad I was here.
What type of questions were people asking you?
A whole lot of questions are regarding their specific situation. So there's a young woman, beautiful young 20-something-year-old who has a specific type of epilepsy called juvenile myoclonic epilepsy, JME, and she hasn't responded to the medications that are slightly safer. So now they were going to move her to Depakote or valproic acid, which is not the best medication for a young woman. There's a lot of side effects involved, like there's weight gain, there's polycystic ovaries, there's hair loss. There's also more risk of problems with the baby if people are on that medication during pregnancy. So she was asking a lot of questions about whether this is the only thing, and like if she has to go, what she can do about having a family. We were talking about like maybe even freezing eggs and saving it would be the best, like if she can do that before she goes on the medication or becomes pregnant. So that's again specific questions that people ask about their problems with the epilepsy and seizure medications.
So why is it's really important to talk about bringing epilepsy out of the shadows?
Exactly.
Why is that really important to do so?
Unfortunately, even in this age and era, epilepsy still has a big stigma. I've talked about epilepsy in public in a lot of places. I've even given talk to like 6th graders in school, because I think people shouldn't be hiding it. This is a disorder that is treatable. But then if people hide that, then they won't know what to do if it happens in the public. If a patient has a seizure, how to make them safe, what would be the reaction to do. unfortunately, because the seizures, they don't have a rhyme or reason. They can happen anytime. It could happen, the child or the young adult could be socializing, and then right in the middle of their socialization, it may happen. People are kind of afraid of seeing even their friends having that kind of an event. So I think the more awareness is there and people know that it's the draw of the lot, and 1% of population have it. It could be you, it could be anyone. So as long as friends can know each other, and if this is the condition, they shouldn't be afraid of it, or they shouldn't be afraid of talking about it.
Okay.
So I think the events like this are phenomenal. They're great to bring that awareness to the population.
And that was what I was about to ask you. Why is it important for people to come to awareness days like Epilepsy Awareness Day?
I think no matter whether they have epilepsy or not, it is important to know what epilepsy is. It's not something to be afraid of. It just means that people have recurrent seizures. Their brain has the tendency for the short circuit, and it's nothing that they've done. It's nothing that they're either born with it or it's something that happened to them. But it could happen to anybody, and I think as long as people understand that it's not a mysterious disease, it's actually a brain matter of abnormal functioning of the brain at a certain time. The rest of the time they may be completely normal. There may not be anything else wrong with them, and it's important for people to recognize what this disorder is all about, and don't be afraid of it.
And that's a really good key is don't be afraid and talk about epilepsy.
Yes.
And it's important. But what happens if families don't listen to you and don't understand epilepsy? What happens then?
The families of patients who have epilepsy?
Yeah.
That would be a problem. Because they are the ones, the support system for that person with epilepsy. So they need to understand what's happening to their loved one. They need to be able to help that person. So I think it is important to have that support system for them, so that they recognize what they're dealing with and to know what to do at the time that it happens, or every issue that this person is going to go through lifetime, either not being able to drive or not being able to work or like other things, that to try to help that person to be the best they can be in the society rather than ignoring the problem.
So final words about your experience here at Epilepsy Awareness Day.
I think it's an amazing day. I didn't know it was this big. It's really, really great. You've done